First of all, I would like to thank the jury members as well as all the participants to this Congress. I would also like to add, we are relatively an old team, and this also indicates that it is a great feeling to be acknowledged, whatever your age is. Our title was The Change of BDNF Levels Under Management in Bipolar Disorder Manic Episode. Just to summarize the contents of this poster, first of all, I would like to describe neuroplasty. This word refers to the structural characteristics and the changes in the functions in the neurons in the brain and their synapses. It also refers to changes in the structure as well as in the functions. And they are also involved in the development of diseases like depression, as well as they play a role in the functions of the central nervous system, and they have important functions in the improvement of these diseases, or we at least know that they are involved in the process. In addition to the depression, mood disorders such as mania and neuroplasty and neurotrophic factors might be involved in the process, and this was the subject of our trial. The objective was, in bipolar disorder manic episode patients, we first wanted to compare the BDNF levels with normal controls, and secondly, to see the impact of chronic mood stabilizers and antipsychotic treatment on BDNF levels. The study was started in April 2005 and spent over 10 months after we compared our results, because all the team members had some problems and we could only start with writing the study only at a later stage. We included patients between the ages 15 and 45 years to the study. As a control group, healthy individuals who were matched for ages, educational level and gender were included. Exclusion criteria included a secondary axis 1 or axis 2 diagnosis, no history of use of antidepressants, oral contraceptives or antipsychotics for the last 2, any kind of a physical condition that may have an impact on BDNF measurements, which may include endocrinological disorders, cardiovascular, hematological, hepatic, renal, neurological, collagen tissue or allergies, or use of drugs, breastfeeding, or abnormal blood workup, which means the health condition should be perfect in the control group. The methodology we have adapted, we first used a questionnaire that collected information on the socio-demographic information, and then at the baseline and on the day 30 we have used the Young Mania assessment scale, and on the first day and on the third day of the study the BDNF levels were measured. If you look at the patient population, the average duration of disease was 9.68 years plus minus 8.92 years. And the duration of the last manic episode was an average 36.68 days. The basal BDNF level in the patient population was 14.35, and the controls it was 40.17, and the difference was statistically significant. In terms of age and educational level, no significant difference was between the study and the control groups, and gender was already matched. 10 patients were started with lithium, and 17 patients received sodium valproate. 2 patients didn't receive additional mood stabilizers. In addition to mood stabilizers, 14 patients received typical and the rest received atypical antipsychotics. After 30 days of treatment, the Young Mania assessment scores improved from 35 to 5.18, which you can see the individual changes on this chart. In the same time period, the changes in BDNF levels were from 14.35 and it increased to 24.48, which was statistically significant. Again, the individual BDNF levels are illustrated on the chart. Different combinations were administered to the patients, and we tried to compare which combination was most effective on BDNF levels. However, among the antipsychotics, the type, which refers to being typical or atypical among the type of mood stabilizers, a positive family history, the intensity of manic symptoms, the frequency of manic episodes, and the duration of this disease had no impacts on BDNF levels. In conclusion, in parallel to the reduction in the young mania scores, there was an increase in the BDNF levels. It shows the effectiveness of the treatment. However, this result also supports the findings that were obtained in animal experiments. However, our results show that BDNF levels may be an indicator of the success of treatment in mania. However, we were not able to identify which combination or which molecule was more effective on the BDNF level change. At the end of the day, the results that we have obtained are correlated with symptomatic improvement. However, we are not able to tell whether there are any improvements in the pathways on cellular level. BDNF levels may be directly related with the bipolar impairment pathophysiology, or it may be an indirect surrogate. In conclusion, in order to have more precise information on this issue, we need larger scale studies which also includes unipolar, bipolar, and euthymic levels with different drug combinations. Thank you very much for your patience.